Hi, folks. My name's Christina. Just waiting for a few more people to trickle in and then we'll get started. Hi, everybody. Just give us a couple more minutes, probably like one or two, and then we'll get started. Thanks for coming.
All right.
Just one of the website went down, so I'm just gonna pull it back up. Give me one.
Sounds good. Thank you, Amanda. And thank you, Christina.
Okay, it looks like we've got 10 or so people, which looks okay. And let me just make sure that we can get the polls going. Okay, the polls up. All right, cool. So, welcome everybody. I think since we have somewhat of a quorum, we'll get started. My name's Christina. I'm one of the EMP tutors, and I'll be one of the folks giving the presentation today. And then we also have another tutor with us.
Hi, I'm Rishabh. I'm one of the EMP tutors as well. I'm a dermatology resident at Baylor in Houston. Very excited to talk to you guys today.
Yeah, and feel free. So the chat is open. You can put questions in the chat, and we'll keep an eye on that. And then we'll get started. Rishabh is going to kick us off. I'll do the slides, and then we'll switch halfway through, and we'll do questions also, question and answer at the end. And keep an eye out for some polls that'll come up throughout. So
Sounds
this is
good.
again. Oh yeah, go
No,
ahead.
go ahead. Go ahead.
Nope,
Oh,
that's
well,
it. Go ahead.
okay. Okay, thank you, Christina. Okay, thank you for getting us started. Yes, so basically, I'm a dermatology resident. I already said that at Baylor in Houston, I just started my second year. So getting used to being an upper level now, exciting times, but also getting ready to take my boards again. So yeah, and then I guess Christina can tell us a little bit about herself.
Yeah. I'm at Penn. I'm an epilepsy and clinical neurophys fellow in my last year after so many years. So very excited. I've been tutoring with EMP basically for like all of my residency and fellowship.
That's wonderful. Okay, so a little bit about Elite Medical Prep. We basically offer all kinds of um, tutoring and guidance for different exams from USMLEs to complex exams, residency, shelf exams, MCATs, and then also advising for medical school and residency applications. And then there are some long-standing partnerships with medical schools as well, as you can see on over here to the side, Mount Sinai, UNLV, Tel Aviv University, and UTMB being some of our partners, where we actually have modules with those places, and we do courses with them for elite medical for exam preparation. So our first poll question, are you applying to residency in the 2026 to 2027 application cycle? Okay, I think I'm gonna put nope, I'm here for the vibes. Okay, that's that. Oh, actually it says we can't vote as a panelist, so great. That's fine. Okay. All right. Okay, perfect. So I think most of us are here. 71% of us are applying this cycle, which is wonderful. Congratulations to all of you. This is going to be an exciting time. And then the ones who are not applying um, right now, this can be early preparation for the future. So welcome to everyone. Congrats. Okay, so a little bit on the timeline for the application cycle. Every year it changes slightly, but it's almost always kind of similar in terms of how spaced apart things are and when the deadline is and all that. So June 4th is when our new ERAS cycle begins. And so it's already begun. And on September the 2nd is when you can start submitting the ERAS applications. And the 23rd is going to be when the residency programs can start reviewing the applications. So what that means, what is that telling you is that you have to submit your application before September 23rd. So I know that's not the deadline when the portal closes, but if you're submitting it any time after that, statistically speaking, chances of you matching can be affected by applying after or matching into the place that you want to go. Of course, there's a lot of like variables at play, but I think you do want to apply before the 23rd. And then the cycle completely ends in May of next year. Okay, this is a very stressful question. So, who has started their application?
We have a few, and
Okay, perfect. So, a very small population of you have been halfway through the application, which is excellent. But then most of you have just started it, or actually, the largest number has not started it yet, which is perfect, which is why we're having this webinar. So I'm excited to talk more about how we can prepare to apply. All right. So first things first, when you think about your professional photo, your headshot for the ERAS. You want to make sure it's a professional photo, you have a professional attire, and you have conservative clothing, which usually just means like a suit or something like that. Preferably, yeah, a suit on a neutral background. So things that are wrong over here with the two pictures, well, one of them is that this is informal clothing that in one of them, and then in the other one there's like a shadow on the face and the background is not neutral. So all those things are can be viewed as a problem on the application. So you want to make sure that your most medical schools actually offer this headshot service when you're applying to residency. And if they don't, then you should get them taken by a professional photographer. Unless someone in your family is a professional photographer, then you can trust them. But I think that the elements that you want to have are a very crisp, clear picture with your entire face visible, your shoulders visible, and then the background has to be neutral. So it should not have any noise or anything in the background. So the attention is completely on you. And you don't want to really, and I think we'll talk a little bit more about in the personal statement, but you don't want to make a huge statement with your professional photo. Your professional photo is just so they can put a face to the application. That's not the place to, start like throwing fireworks or something. So just keep it simple and yeah. Okay, so ERAS application experiences. Yes, so this is exactly the same as like when I applied, which is, you have your 10 experiences. So again, like you cannot list infinite experiences, so you really want to prioritize the ones that truly meant something to you. And then there will be three that you can expand on even more than the allowed word count for the other seven. So basically, when you're describing these things, you do, of course, want to say what you did, but I think but that has to be the shortest part of your description. What must come first is what was the output of what you did. So what was the outcome and what was the eventual consequence of all this experience, and how did that experience change you? So you always have to think about concrete examples, and if you have numbers or metrics, I think that helps. Like, for example, like you raised money for some organization, and then that money was then used to fund a research project or something like that. So then all those are deliverables from that experience. So you need to talk about experiences in terms of output, so that when they read the experience, they feel like there's an impact that you had with what you did, rather than just saying, oh, I like was at I don't know, like summer camp for something for a summer and I really enjoyed it. If you just write that, then that doesn't sound meaningful, even though it may have been very meaningful. But I think it's all about how you market yourself in the application. So just keep that in mind that you're giving concrete examples of what is what did you learn from the experience? What were your deliverables and output from the experience? Okay. So then talking about research, which is one of the most stressed about parts of the application. So I think depending on the specialty again, like that you're applying to, there's different research emphasis. So like in dermatology, I can tell you like it's ridiculous. They're very, very obsessed with research. So there you really have to make sure that you make those experiences count. There is anything that you worked on is fair game to be added. When you're doing these, a lot of times, if you have had an abstract, a presentation, and a publication from the same project, all of them go onto this. So you're technically getting three items on your research portfolio rather than just one. So you want to make sure you don't like overlook any of your experiences, make sure you're completely transparent about everything that you've done. You don't want to undersell yourself over here. At the same time, I think deciding on the placement of these experiences. Oh, yes, and I see a quick question. As an IMG doctor, can I write the experiences I had in my home country? Yes, you can write about all the research experiences that you had, even in your home country. Everything is fair game. I do think that it's important to keep in mind that if you're putting a research project on there, you should be very, very prepared to answer questions related to that research project. I remember when I was interviewing, they would pick up a random publication or abstract and they would ask me, so what were your findings? Where did this go? Like, what was the outcome of this? And so, having a clear idea of your studies is important. And especially when you're applying to a research heavy field and you may have accumulated a few publications or posters and abstracts, it's easy to forget what you did. So make sure you read up on all your things before you go to the interview. So you sound like you know what you're talking about and you're prepared. So that's going to be an important point. And then I think that when you're, whatever research experiences are very important, if that's something that was emphasized in one of your meaningful experiences, like for example, you worked in an NIH lab and then you got a patent on some technology or whatever, then that sounds very meaningful. And so you can like your placement of your research on that list, because it'll generate a list for you, um, can also be in such a way that you're placing it at the top of your research experiences. And that makes it more likely for them to ask you about the research that you did as part of that meaningful experience. So make sure that what you put in your meaningful experience and what you're listing out in your research bibliography is concordant, and the story is matching everywhere. Can I add a dissertation thesis writing I completed over 10 years ago? Also did a present. Yes, so I think so you can do a dissertation thesis writing as long as it was in college. I think you can. Yeah, so and again, like it depends on like what the topic is, how useful will that be to your application. But yeah, I don't think they have a limit on like how far back. Okay, for masters, yeah, of course, you can write that. So I think that there's no limit, and Christina, you can correct me if I'm misremembering, but I don't think they said that you can only go back like 2 years, 3 years. No, right? Like you can just put.
No, you can include whatever you want. I think it's just like
Okay.
in general, it's a good look to have recent stuff that you are working on or did.
Yes. But if you have older things, feel free to add them, yes, because there's no limit to the research.
This is where I take over.
Yes, I'll chime in between.
Amazing. Fabulous. All right. So next chapter that we will talk about is your personal statement. So in general, this is a chance to, this is like the only sort of free expression you have that's not formatted in here. So my recommendations for the personal statement is start early, write it as early as you can. Send it to people going into your field, send it to people not going into your field, send it to your friend who's an English, like literature, grad student. Get a lot of people's eyes on this. You don't want there to be errors. You want it to look professional. But I think it's really important to have somebody within your specialty review it because they're going to give you kind of, and specifically not, another med student, right? But like a faculty member who is your mentor in the division, have that person review your personal statement and provide you critical feedback so that it can be as strong as possible for your specific area of application. Um, so you want to kind of pick whatever your central theme, central story is. And the main thing, which is true for personal statements, but is also true for all writing, is that you want to show, don't tell. So what that means, instead of saying, I am very hardworking, I really care about my patients. You tell a story. I am really caring and hardworking, and I'm devoted to my patients. I had a patient who had amyloidosis of the liver, which required like a relatively new semi-investigational drug that was being piloted at our institution. I reached out to the principal investigator of that study and helped get my patient enrolled in that study. That's a good example of you taking initiative, showing something that you're doing rather than just explaining qualities that you have. And that's much stronger evidence than anything you say about yourself. And we'll have examples of that too. Okay, so let's see what people think. Tell us about your personal statement, and it's okay if it's not done. Okay, so it looks like we've got uh, a good amount of people with a little bit creative and professional mix, and I think that that's good, right? You want to open with some sort of strong story, but then you need to weave in your like personal with your professional to really sell yourself to the program. And also, if folks haven't narrowed it down, that's okay as well. You have time, and that's kind of why we are here. Okay, so this is an example of what not to do. So this person is saying, I'm applying to internal medicine because I have a passion for complex diagnostic challenges. During my third year, I found the field intellectually rigorous, and I have all these skills, including good communication, and I will be passionate and I will be competent. Yes, to the person who said, sorry, is it both? Yes. So I think that it is certainly a mix of personal and professional. So the idea is that you want to tell some story that happened to you about why you're going into the field, right? You're sitting in front of this person trying to get them to understand why you're going into the field, right? What is special about you and your experience? So you want to convey an experience that demonstrates your interest and aptitude in the field. So it's personal insofar as it's something that happened to you, and it's professional in that it is an experience that is related to your field and demonstrates your interest and aptitude in that field. So, again, kind of highlighting what the don'ts are. So, passive phrases was developed, it was observed. You want to use active voice. And again, this person is telling the reader rather than showing the reader with anecdotes and evidence. Um, and then avoiding cliches, right? So, like, internal medicine is all about the puzzle. I'm a neurologist, and neurology is all about the exam, right? Like every neurologist likes the exam, so you have to have something else, right? To tell why did you decide to pick this field? Do you think that AI can be used as a tool for writing your personal statements? I would advise against it. I would advise to write the personal statement from scratch yourself. I think it is reasonable to use AI as like an editing tool if you want to look for like spelling errors, things like that. But to be honest, we unfortunately are still in an era where AI written content, in my opinion, is like very obvious. And that is like the last thing you would want a program to conclude from your application is that, you're not dedicated and used AI to generate like a very generic personal statement. So I personally would not do that. Okay, so here's a better example. Miss Henderson's chart was a puzzle. For weeks, she had a variety of these symptoms. And so each night I was scouring the literature looking for what could possibly be the cause of her symptoms. And then ultimately, I told the attending I thought she had adult onset Still's disease. And then she had a clear response to the therapy of choice. And this was kind of an electrifying moment for me, driving me into internal medicine, right? So this person is saying it's not about solving the puzzle, but it's really about the process, which honestly is all of medicine, right? So this person did a much better job, right, than the prior. So what is good about this? I remembered, not I was shown or I had seen, right? So active voice. And then you want to show again experiences, examples. I read med students' personal statements all the time, and this is the thing I correct the most. Like, I do not want to hear, like, oh, I like this, I like that. No, show us what you did. Show us like what you're passionate about and tell a story. And then you want to make sure again that it's like personal, like we said, a mix of personal, professional. So it's something that happened to you and shaped you and connects you to the field of study that you are choosing. Okay, this is very important. Letters of recommendation. So I strongly recommend, again, finding a mentor within your field to assist you with letters. Depending on the specialty you're going into, there is like a standard generic letter. So typically all medical schools have like a medical student performance evaluation slash like dean's letter, which is a generic letter from your school, which will go out. But then in addition to that, certain specialties need like a chair's letter from the chair of your division. And it kind of depends on what you're going into, what specific letters you need. So make sure that you have your required letters, meaning your like medical school performance evaluation, and then also if you require like a chair's letter, something like that for your specialty. Then in addition to that, you have like your personal letter writers. So you want to ask people early and give them time. So in my opinion, like the best time, especially for subspecialties, is to do it during your sub internship because during your sub internship, you're doing an acting internship. You have a ton of patient responsibility. You're working really hard, demonstrating your skills. At the end of that first week or that second week, if it's going well, you can ask them if they will write you a strong letter of recommendation. You can send this over email. And I strongly recommend against asking for a letter from someone who you do not know, have not worked closely with, or do not have good feedback from. It is very clear to panels whenever, students are applying when letters are weak, right? So they want the letters to be strong and specific. So in order to have a strong and specific letter, it needs to be someone you have like a good relationship with or you have impressed clinically. And they need to write the letter when they remember who you are, which is why asking them to do it shortly after you work with that person is helpful. So I remember when I was a med student, I would do a random rotation and I would get really good feedback with somebody. So I'd say, okay, this person likes me. I'd send them an email right after saying, like, hey, can you write me a letter? Those people will typically write the letter right away because they remember you. And then, in 3 months, they can give it to you and say, like, here's your letter, right? But at minimum, you need to give them 4 weeks. The other thing, and this is true forever, by the way, like, like I'm applying to jobs and like, or when I was applying to fellowship, for example, they also wanted my personal statement and my CV. Like, this is just tale as old as time. So they're going to want your personal statement and CV, AKA like your resume, so that they can insert impressive things about you in the letter, right? So they're going to pull in what you said and they're going to try and bolster whatever your goal is from your personal statement. So have your personal statement and your CV ready to send to your letter writers when you ask them to write you a letter. And then make sure that you send them reminders because God forbid that they don't finish that letter by September 23rd and then now you're delayed. Technically, letters can come in a little later, but in an ideal world, you'd have your letters in early and complete. And then make sure that you're kind and say thank you, right? So you can remind your letter writers, hey, like, I haven't, just want to check in about the letter. It's due in XYZ time. And then when they do it, you can give them a thank you.
Can I chime in here
Hmm.
about the 2 points about letters? So two things I wanted to say. One thing is that you want to make sure when you ask for that letter, like Christina said, you want to make sure you're asking someone who you know well. And then I personally, when I email people to ask for a letter, I will always say, are you comfortable writing a strong letter of recommendation for me. And I always bold it because sometimes our perceptions may not align with what the other person thinks about us or, is comfortable with. So I think that strong with the bold emphasis is really good because if they are going to write you a lukewarm letter, you don't want it because that can really hurt your application. So of course sometimes we don't have a choice. So like whatever you have, you make do with that. But I think the ideal scenario is if you can get a strong letter. And most people are pretty honest because I've given this advice to a few people, and sometimes the person will respond back and say, well, I don't think I'm comfortable writing a strong letter because we didn't have as much contact. And I think that honesty is very important. And on your side, as to what you want, and on their side, as to what they can provide as well. So that's one thing. The other thing I will say is, and I don't think this is talked about as much, but I think you can definitely also club letters. And so this happens a lot when you may have worked with multiple people who you really liked and they all work together. And so maybe your letter can come from two faculties or three, the same letter, which is written in combination by all of them. And that can be a beneficial thing if you're applying, well, at least it is in like competitive specialties when you want to demonstrate a broader, level of support from a certain department or a group of people, because the more number of people that you have backing you, it looks good. Now, of course, you want to make sure that it is written in a collective voice and there's not any like discordant, messages being given in the letter. But I think that that works out if you have a mentor who's going to write a letter and get like more information from two other people that you also work with, something like that. So I'm just saying that having like the limit of four letter writers doesn't mean that four people are only writing your letter. So if you wanted to club certain letters, you could, if you felt that people could coordinate together and write the letter for you together.
Awesome. Those are all fantastic points, and I agree with them. The other thing I forgot to mention too is that, like, depending on your specialty, right, it kind of like shifts who you pick for letter writers, but obviously your letter writers should be within your specialty, especially when you're applying to a more niche subspecialty. And the other thing that I would recommend is like often your research mentors are really great letter writers because that person, if you've done like research with anybody, like it takes time, regular meetings, check-ins, writing the paper, the poster, presenting. Like there's so many longitudinal interactions, and like the people who are reviewing these applications really like to see people dedicated to a single thing over a long period of time, like continued demonstrated interest. So having that experience paired with a strong letter from a research mentor is also like a really strong thing. But if research is not your thing, like I was the director of our free clinic and I had our free clinic director write a letter for me because we worked together literally every day, seemingly of my life for 4 years, right? So that person knew me really well. So it's, it doesn't have to only be like a clinical person, or I should say somebody that you did like a sub-I with, like anyone you worked with for a long time in the medical field or related activities is a good person. Okay. Um, Yeah, that's a good question about the prelim year. I think both of us. I mean, I certainly had to do a prelim year. You also had to do a prelim year. I'll speak to you can speak to yours. For me, basically, I was told that most of the programs don't care and are happy to have like you just give your like for me it was neurology, give your neurology personal statement. So they said like you can just give that and you can give all your neurology stuff and they understand. Some of the like standalone prelim programs, I did like slightly alter my letter or I should say my personal statement. And then I had like, in addition to neurology letters, I had just like, I had more letters than I needed. And I kind of would like shuffle them into programs as I felt they were strongest. So when I was applying to standalone prelim programs that had like no linkage, sometimes I would then add like sub in one of my IM letters of rec like from an IM doctor, even though it was like she's going into neurology, just so that they had like that flavor. So that was what I did, but I don't know about your experience.
It's the same. I think that I was also told that it doesn't really matter. Uh, but uh, but I was like, well, maybe I don't know because my specialty, um, well, even though we have a lot of overlap with internal medicine, but still like a derm letter is going to be written very different to like an IM letter. So I still got my sub-I, which I did in internal medicine as a medical student, my sub-I director to write a letter for me. And he kindly provided that. But I think, yes, and if it's a standalone program, which mine wasn't, but if it is a standalone prelim program, then they might require uh, a little bit more effort on your part. And so maybe that means that you need to get a letter from someone who has the prelim year. But yeah, otherwise, I don't think it really matters. For most programs, you can just use your regular specialty letters. And then I guess there's some like other questions
Yeah, I
like
saw one
dual.
of them I can answer. So standalone, I just mean that like, so for example, my residency, the prelim year was like linked to the neurology program. So when I applied to neurology at Penn, I sent one application and it went to both medicine and neurology. And then I had like a medicine interview day and I met the Penn medicine program director and the medicine people all interviewed me, blah, blah, blah. And then, a few days later, the next week, I can't remember, I interviewed with neurology. Same thing with like Mass General, like they had like an entire day of like the medicine people interviewing you. So the medicine people felt comfortable accepting you independent of the neurology program. So like a lot of programs, at least for neurology, are set up that way where they're linked up. And so you can kind of like, it makes it easier for you. A standalone program would be like, this is just a slot for a prelim year on its own. And then when you apply to residency, you apply to something called an advanced program instead of categorical, which means that you just like join them after you do your prelim year. And so that's like what we're talking about. So like a standalone program, no affiliation, like maybe you want to slot in a couple more medicine things, but like any program that's linked, like the person that you interview with in medicine knows that you're going into neurology. Like it's not like they wouldn't in standalone either, but the standalone programs, I've like there's more competition, right? More people are applying to those slots because it's like everybody versus like the linked programs is like your specialty. Um, would this apply for a transitional program as well? I think so. I don't know. What do you think, Rishabh?
Yeah, I think it's the same thing. Yeah. And then someone said, did we already talk about the dual applications? No. Oh, what? So dual app? Did we say that in our one of our answers? Did we say
Um,
anything about dual?
I didn't I at least I didn't intend to say dual application. I think what I meant more was
Mhm.
that like you can have multiple letters and send like some to a prelim and some to your primary. But dual application to me, that concept means that you're applying to multiple residencies, which we did not talk about.
Multiple. No, no, yeah. Hmm.
Okay, we'll keep going if we got all of these. All right. Um, okay. We talked about this. So basically, um, somebody had said something earlier, I think, about like, is there any advantage to submitting the applications September 2nd versus September 23rd? So September 23rd is like the due date, and you can imagine that like busy medical students are all going to rush to submit at the 11th hour. And God forbid there's a technological issue because everybody is swamping the system. So I personally submitted it like a week in advance. I was like 100% done, so I didn't have to stress about something happening last minute, my application not getting that nice timestamp that means that it would be reviewed first by programs. So I would strongly recommend not submitting it on the 23rd, but I mean, technically you could submit it at the deadline. Um, so
Yeah, because
basic,
I
yeah,
don't
thank
think.
you.
No, no, no. I was just gonna quickly add. I don't think that the order in which you submit matters if you submit it on the 15th versus the 17th, right, Christina? But yes,
Exactly.
like if you're submitting it on the 23rd, that has the risk of, not being able to submit because of something going wrong with the website. So just do it a little early, but doing it on like September the 3rd versus the 17th doesn't matter.
Yeah, exactly. Exactly. But yeah, make many drafts. I have anecdotally, I feel that when you look at something on a screen, it's easy to miss typos. So I liked to print mine out and like annotate it with a pen. Try and keep it concise. And yeah, like I think the key is like make sure you look at that. There's like a way to preview the applications that it like spits out what it would look like to the program and just look at that, make sure it looks right to you because this is like part of your impression to this program is like how that comes out, how professional you look. So you want all of that to look good. And then, yeah, submit it before the deadline. But in terms of the days before the deadline, as long as you're before the deadline, the exact day does not matter. It's all going to be time stamped as like the deadline, or not the deadline, but like that line we said, the 23rd. Okay, interviews. So this is extremely important. So I think the first thing is that like unfortunately, I personally feel like people in medicine, myself included, don't really like to self-advertise. It's very like you just want to like let your work speak for yourself, but you do have to self-advertise here. So you need to think, take some time to reflect, like what are your strengths and what do you bring to the table and why should they pick you? Because like at the end of the day, you're going to be sitting in front of this person, like semi trying to convince them to take you. And like I have actually had interviewers say, like, you have, like, I'm going to give you the next 3 minutes. Like, tell me why we should, like, go ahead and brag and tell me why we should, like, accept you in our program. And you have to be kind of ready for that. So, why are you a good fit for their program? And then also, why are you applying there? Like, I think this is especially the case. Like, they added signaling and all that stuff to try and, like, get over the issue of people applying to a lot of places, but a lot of programs are sitting there trying to figure out if you're interested in them. And a way to show that you are interested in them and have intentionally chosen their program is to say, like, oh, well, actually, I'm really interested in your residency because I'm interested in global medicine. And I saw that there's a global medicine division and there's annual trips to Tanzania with Dr. So and so. And I'm really interested in getting involved in that. And some of my research is related, right? So that shows thoughtfulness and that you intentionally applied. If you don't have anything to say about why you selected their program, then they're going to be less likely to rank you because they will think that you're not as interested in them. So even if you don't want to go there, I still recommend you come in prepared and ready to answer those questions and, sell it when you're talking to somebody and like specifically how you fit in with that program. Um, there's a million obvious questions that you will be asked, and you should be ready to answer them. What I did, we have questions here. I like on a Word document wrote out like bulleted answers, paraphrase to all the different interview questions that I could theoretically be asked. And then before an interview, I would like review them so that when they're like, tell me about a time that you resolved a conflict in the hospital, I could be like, oh yeah, I had pre like selected an anecdote and I remember it and I'm going to go instead of sitting there and kind of thinking. You don't want to like rehearse it too much so that it doesn't feel natural, which is why I recommend bullet pointing it so that you just like have the memory and can draw from that. Or like, similarly for like your strengths and weaknesses, so that you know them and then you can kind of talk about them. And then again, you have to prepare thoughtful questions for researchers. You will be asked 100 times what questions you have, and you should have questions. So, come to the table with questions. What I would do is I'd look up each person interviewing me and like try and figure out like what their deal was. Like, is this person like a superstar clinician and their community advocate? Is this person a high-powered researcher? Tail my questions to that. So, like, ask the researcher, like, what are their ongoing projects? What are like opportunities for residents to get involved in research? Ask the community engagement person. I'm really interested in community engagement. How can I get involved in that as a trainee, right? So tailor your questions to your interviewers and then make sure you have a nice virtual setup. So some of you will do in person, some of you will do virtual interviews, some of you will do both. And so you want to look professional, right? So that means like a little light. You don't have to buy a ring light, have a lamp, but have good lighting, neutral background, appropriate clothing, and test out your audio interface with somebody. Like I did a Zoom with my like family, and I was like, how does this look? Right? Just have somebody take a look. And then just make sure that you're being like thoughtful with your follow-up. So some programs like explicitly are not allowing, thank you notes because they would like overwhelm their administrative staff. Some are fine accepting it. So just kind of like listen to what they say during the interview day.
And one more thing that I might add about just maybe a couple of times, what you can do is you can look at you can just film yourself on Zoom, record yourself giving a couple of answers, and then just watch that tape. I know it's really cringe-inducing, so I did it like a couple of times and I was like, I cannot do anymore. But, I think it can be useful to see like what are your tics and things that you do that you don't even realize, like changes in your expression or your eye contact or many other things that may be going a little wrong while interviewing. And then how well do you answer a question? You can also kind of evaluate that as you go through the recording of the Zooms, because that's where the most of the interviews are going to be. So it's nice to just watch it back again and just do a little analysis.
Agreed. That's excellent advice. Okay, so here's some examples of some questions, and you should have answers to all of these, right? Tell me about yourself. Every single person you talk to will ask you that. Why do you want to go into this specialty? What are you looking for? What are your strengths? What are your weaknesses? And then, like, I'm going to draw specific attention to, like, where do you see yourself in 5 to 10 years? Because, like, to be honest, none of us as like an MS4 are probably, maybe some, but many of us are not going to be right about like what's going to happen in 10 years. So it's not like nobody holds you to this answer. So just have something like that is somewhat resonant with you to say about what you think your trajectory is. Because the reality is you have no idea what's going to happen. You're going to, like, if you're an IM, right, you're going to get in there. You think you're doing cardio. Oh my God, wait, you love the gastro service. You're obsessed with liver. Now you're going to do a transplant. Like everything changes so much. So no one's holding you to it. But the point is that they want to kind of understand and like bucket you as like what like if we hire this person as a faculty, like what kind of faculty are they going to be? Like are they going to be the clinician educator who's like working intimately with the residency program? Are they going to be like the community advocate who's going to all the fairs and doing education? Are they going to be the researcher who's going to be R01 funded 80/20 researcher with a little bit of clinic on the side, right? They kind of want to like have an idea of what they're getting. So come up with a pitch and give your pitch. And nobody in 5 years is going to say, oh, well, you didn't do like what you said you were going to do over Zoom like 5 years ago. No, that won't happen. But you have to have a good answer for them. And then be ready for like these challenging questions. So when did you have a conflict? What is a mistake that happened? Tell me about a difficult time, right? They're going to ask for anecdotes and they're usually going to ask about like challenging situations. And in general, you want to demonstrate that like you had situational awareness, you had empathy, and you were able to directly address your mistakes or the challenges that you faced. Ethical questions, hopefully these are straightforward. I didn't really get these when I was interviewing, but I have heard that they happen. So like think maybe like 13 is a more realistic one, but in general, like if somebody is working while impaired, you should report that person, right? Um, the latter two, I think, a little more clinically applicable. So think about that. Like, how would you prioritize 3 admissions at once? Who's the most unstable? Who requires the quickest intervention? Who is the patient that needs to get your priority first, second, and third? And how are you going to determine that? Like vitals, labs, right? And like maybe interventions that those people need. So like think about those things. And then program and fit, this is what I said about before. So you want to have like you want to have specific answers to why you want to go someplace. So like especially people if you're going one coast to another, they're going to be like, "Well, why do you want to come to XYZ place?" And like the answer can be their program if it's a right fit, but don't be shy. You can mention that like, "Oh, I'm from this area or whatever," to further draw your connections. Um, and then be ready to talk about yourself as like a human. They love to talk about your like hobbies and interests. What do you read? What sports do you do? All of that stuff. They also like to talk about that too because they want to get to know you as a person. Also, because interviewing somebody and only talking about like like their professional accomplishments can get a little slow. So that is it. Rishabh, do you have anything to add?
No, I think that was
Okay.
really good.
What other questions do you all have for us?
Um, I can take this one, or at least of what I know about it. I think from my understanding, or at least when I applied, I don't think you could add more letters after you'd already submitted your application, right, Christina? Right?
Yeah,
Did
not
you?
to my knowledge, because it's
Yeah.
like a PDF that they like shoot like when they get it, they like shoot it off. So I don't think so.
Yeah. Hmm.
I think if you are trying to apply to the US, like if you are trying to enter a US residency, then you will need US letters of recommendation. So it's not that you can't use a letter of recommendation from your home country, but typically like when I advise IMGs, like what I recommend they do is they do something called an observership, which is when you come to the United States, you have to apply to it. So you have to reach out to a bunch of programs, come and do basically it's like a med school clinical rotation, but it's an observership in that because you are like from an outside institution, you can't like actually like, put in orders, do things like that, which is why they call it that. But then you work with those people in that observership for 2 to 4 weeks. You would do several observerships and then ideally get several letters of recommendation in your specialty from the US because most US programs will not accept only outside letters of recommendation. And like the strongest way to do that is then you do an observership at an institution, get a letter from that institution, and then apply to that institution with a letter from somebody internal. That's like the strongest way. I've had several students match that way.
Dual applications. Or wait, no, someone said something else. What was this? Sorry, I mean,
Yeah, it's okay. I'm going through too. So this one says, do programs filter out IMGs if they do not yet have ECFMG certification? I don't know, but I assume yes, because ECFMG certification is needed for like basically all of the pieces of the application. It says, I mean, if
mm,
you've passed step one and step two at the time, but yet to get certification, will you be filtered out? Uh, I am not sure, but I feel like probably. I don't know. Do you know?
no, yeah, I think that's my understanding. You need the
Yeah.
ECFMG certification before applying. Dual applications. So yes, so from what I think both of us understood was that dual application is like when you're applying to two different residencies. Yes, some people do that. I do think that that is a very tough and challenging thing to do. I know some of my co-applicants in derm had applied to different specialties because they felt that they could be happy in multiple things if they didn't match into one or the other. So that is something that can be done. But then you will really have to, you're basically doing two different applications because if you let the one residency know that I'm applying to another residency, you're probably my backup, like that's definitely not a good thing. And especially for residencies like derm, when your application is filled with derm publications and things like that and you're applying to radiology, they can sometimes tell. And sometimes like, and I've heard horror stories, like sometimes people will not even like bother to change their personal statement and they'll submit it to another specialty, which is a huge no-no. So you want to make sure that if you are truly applying to two different specialties, you treat them as two different applications. You're very intentional about the experiences that you are putting on there or highlighting on there that are relevant to that specialty that you're applying to, and no mistakes in terms of typos or anything where you're meant to say one thing and you're saying something else from the other specialty's application. So it just is a much more taxing process, but yes, people do it and it can be done. I think we have a
Yeah,
lot of
agreed.
cooperation.
Yeah, I'll go. So this one says, do you have experience with couples match? Personally, I don't. However, when I was in
Same.
med school, a lot of my friends did this and it worked. The general principle for couples match is that whatever you would normally need for your specialty, you need to like double, if not triple that, like because it's like a statistical problem. Typically, if you were trying to do, like, it depends on the competitiveness of the specialty. So, like, my friends that I'm thinking of were trying to couples match into orthopedic surgery and ear, nose, and throat residency, which are like two of the most competitive surgical specialties. So they applied to like 150 programs, right? Because they were like really trying to increase the odds. So in general, if you're planning on couples matching, you need to meet with a mentor or advisor in your specialty that can advise you about how competitive you are, how many places you have to apply. Same for your partner. And then the both of you need to speak with them about the fact that you're couples matching and they may like numerically recommend you increase the number of programs that you apply to so that you both can match. And I had like two of my close friends were like applying to less competitive specialties. Like the two of my best friends were EM and PEDS, and they both couples matched. One of them was a really strong applicant, like way kind of above what they were needed. The other one was not as strong of an applicant. And so as a result, like the stronger applicant did not match at their top institution because there was that discrepancy, and they ended up like matching kind of a little bit down the rank list because of that discrepancy. So just like keep all of those things in mind. It can be done, but it's like a complicated system, and you need to get a lot of advising from your institution and people within your specialty.
Okay. How can I address gaps in my ERAS CV? So I think, well, my question would be like, what kind of gaps are we talking about? Because I think I don't know. Do you have any idea, Christina? I think,
Um, yeah, I think it really depends on what you mean when you say gaps.
yeah. How
As
do
an
residency
IMG,
programs?
oh, sorry. I think they answered
No,
when
no.
they said I worked at a medical assistant for a while and took a year off studying for step one and step two. I mean, there's like, I think that isn't there a section for like, adversity or things like that, and you can free text? I thought there was like a section that you can talk about.
Yes. I think I think there is a section for adversity. Yes. There is
Yeah,
an
so you
adversity
could,
section.
yeah,
Mhm.
so I think it's free text. So you could add like, I like these are the gaps in my, it's like there's like a place like address deficiencies, and you can say like this is what I did and that's why it took that long. But to be honest, like if you worked as a medical assistant for a year, that's on your CV, so it's obvious what you were doing that year. I think taking a year off to study for step one and step two, that's a little like less common. And so that they'd probably want to know like what you were doing over those years. Sorry, Rishabh, I think you were answering another one.
Oh no, you're fine. That was how do residency programs evaluate research experiences that are still in progress? What aspects of the early stage project should I emphasize if data? I'm sorry. What aspects of the data? Yeah, so basically of data collection outcomes have not yet occurred. Okay. So yeah, I think I had this problem because I was applying to term and I decided quite late. So I had a few projects that were not published when I applied, but they were all good projects. So of course they were not going to be published before I applied. And what I had, like I basically asked so like Christina said, you ask your research mentors to write your letters because they always have really good longitudinal experiences with you. So if you have a really good rapport with your research mentors, you can ask them to talk about how much you contributed to a really good project. What is the status of that project? What potential do they see in it getting published, so they can talk about all of that in their letter of recommendation, and that can really validate all the work that you've done. So like two or three of my studies that were not published, they were mentioned by my research mentors in all of their letters because I requested them to put that in there. And then when I interviewed, we did end up discussing those projects, and basically those were the ones that we talked most about, not the couple of case reports that I'd published. So, like I think the true essence of like if you are truly saying that you did research for an application, it's really about the quality and not the quantity. Especially I think when it comes to like the interview and talking about research experiences that had a huge impact, because anything that's going to be having a good impact, it's not going to be easy to publish. It's not going to be done in a couple of like days or weeks. Like it can take a while to get out a good study, and then you get it rejected by the journal, then you have to submit. So there's a lot of like stuff that goes on that is way, way beyond like our ability to like fit everything within that timeline that ERAS imposes on us. So yes, have your mentors mention it in their letters, and then you can have that validation to like discuss it in your interview as well. So that's one way that I can answer on that. What's the
And
next
I think
one?
that's it just because we're at 8 o'clock. So
Okay.
thank you everyone for participating so avidly throughout this. We're really happy to answer all your questions. We know that this is a scary time, so thanks for spending the time with us. And we hope to see you all, someday in the hospital.
Thank you, thank you, thank you, everyone. Good luck.